Hi, my name is Malaika and I'm going to share with you 5 movements that you can do today to sort out pain in your upper back or any part of your back actually from infant care and breastfeeding. We know that when our babies are little, we are spending a lot of time curling over them, supporting, cuddling, nursing, feeding, and caring for them. And our backs and necks can take quite a toll. So the first exercise I'm going to tell you to do every day, or as often as you can, is hanging. It's very simple. It's finding a sturdy surface. Now make sure whatever you're hanging from is sturdy. A chin-up bar would be preferable, but you can find monkey bars or another sturdy ledge. And you just want to hang. So curl your fingers around. You can do 2 hands. You don't have to hang your full body weight off. You don't even have to have 2 hands at the same time. You could just have 1 hand. And you want to twist and rotate around that hang, right? So make sure you're opening the shoulder and working around that joint as you're hanging. Practice different grips of the hands, forward, back, etc. And just hang for as long as you feel like it. That's exercise number 1, hanging. Oh, it feels good. The second exercise, I'm going to say you have a choice. This is the first is the Makaho lung meridian stretch. So it's going to open the front of the body and the meridian that's responsible for our breathing and our lungs. Take your right hand and wrap it around your left thumb. Inhale and roll your shoulders back. Nice wide stance of the legs. And then you're just going to fold at the hips and hang forward, nice and easy. Not pushing anything here, you're just letting gravity help you hang forward. And you're going to breathe here. This is the lung meridian stretch. Stay here for a few breaths. Enjoy the view. Maybe you're watching your baby from upside down. Pull up to come up. From here, you're going to place your hands into 2 fists. Push it into your lower back. Sorry, into your sacrum. So the firm part at the back of your pelvis. And do a little arch to come back. Release. Grab the other thumb and repeat on the other side. Makaho lung meridian stretch. If you don't want to do that one, you have a choice of a counter stretch, which is going to do a similar sorts of thing. So a kitchen counter is a great height to do that. Oops, there's my notes. Kitchen counter is a great height to do that. It's a bit higher, but any table will do. You place your hands flat on the table and you just walk back until you are roughly at a 90-degree angle from your hips. Then you just hang your head down. Your feet should be pointing straight ahead, more or less under your hips, but you're just going to press strongly down into your palms, but let your head and chest hang away from that bridge that you're making. This is called counter stretch. You breathe here, you enjoy. If you want to, you can take a step back with one leg and tilt your hips, looking under one armpit. You can try the other side. Bend one knee, look under one side. And when you're ready to come back up, press down into the palms, curl under with the spine, and begin to take small steps up as you walk closer to the counter, rolling your head up. Last, take your time with this. And you should have a nice tall feeling at the end. Take a little walk around after that one and make you feel a little lightheaded. So that's exercise 2. You have the choice of the lung meridian stretch or the counter stretch. For the third exercise I'm going to recommend for infant care and breastfeeding, it's called the deep squat with a spinal twist. So you want to separate your feet, take a nice wide stance, toes pointing out to sort of this angle, and you're just going to drop down, drop your bum down. Pressing your knees into pressing your elbows into your knees, you're going to shift your weight from side to side and ease yourself down. If this is a tricky one for you, take your time here. You can also place your hands on the floor and just ease yourself down. Eventually, you want to get your hips lower than your knees, and you're going to press your elbows out into your knees and hold, right? This is the first part of that exercise. The second part of the exercise is to keep the tension, keep pressing that elbow into the knee, lift one arm up, and look under the armpit. So you've got a spinal twist here, and breathe. You should feel it all the way from your tail your top of your spine. And then you change, right? Pressing the elbow into the knee. Keep the traction there. Press one hand down into the floor, lift the other hand up. And just look past the armpit behind you and breathe. Nice deep breath into the lower belly. Nice and relaxed. From here, back to the center. Press into those knees with your elbows. If you need to push into the floor to come up, that's fine. Find your own way up and just shake it out. Okay, that's exercise number 3. Exercise number 4 that I recommend is plank variations. Now, if you're newly postpartum, that can be a plank variation against the wall. So you can press your forearms into the wall, step a little bit away from the wall, and create a hollow body feeling in your belly. You can also step to the side with this side plank, with this wall plank. And what you're looking to do is integrate the sense of integrity from the top of your spine, top of your head, all the way down to your feet as one long line. And as you go to the wall, you don't want to sag in, you want to lift up and out. So you've got this sense of a hollow body. You're lifting and lengthening the area from your hip to the bottom of your ribs. You're lifting and lengthening your waist in each situation. And just breathe here. That's the easiest plank variation. And as you get more comfortable, you can begin to lower yourself down the wall and begin to increase the distance that your feet are from the wall. Eventually, you'll be ready to return to the floor for plank variations. I have a longer video on different kinds of plank variations, but in the short term, you can go from your hands and knees